Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health? Just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 21 of the Ask Dr. Angela podcast. I so hope that everyone is enjoying the fall. I think that I've mentioned in past podcasts that we certainly are. No more air conditioning, which I'm super excited about. The nice evening walks, picking apples, doing the other fall stuff like hay rides, corn mazes, visiting pumpkin patches. Speaking of corn mazes, have you ever gone to a corn maze and you couldn't find your way out and you had to have them come in and get you? That's happened to me before. Talk about embarrassing. Anyway, today's question is coming to us from Sonia in Northern Virginia. Hey, Miss Sonia, what do you have for us today?
Hi, Dr. Angela. My name is Sonia, and I am calling from Northern Virginia. My question is this. We know that there is a small amount of caffeine in decaffeinated coffee. So how much decaffeinated coffee, if any, is healthy, recommended, or allowable during pregnancy? Thanks, Dr. Angela.
Miss Sonia, thank you so much for submitting this question. Talk about asking and receiving. You guys totally listen to me. I asked for more pregnancy questions and they have been rolling in. So to get to your question, how much coffee can you drink during pregnancy? I'm not sure how many of you out there are coffee drinkers. I'm a coffee drinker, but I drink coffee not so much for the caffeine jolt or energy. I've got plenty of that on my own, but really mainly for me, it's because I just like to have something warm in my hands and to drink. I am cold all the time. When I was pregnant, I still did my grande soy extra caramel macchiato from Starbucks on a daily basis. And then I got rid of the caramel because it was hurting my teeth. Talk about a sugar high. But anyway, enough about me. The number that keeps coming up is 200 milligrams of caffeine daily. And when you're talking about coffee, that's about the equivalent of like 2 cups of coffee a day. So, Sonia, I think that, you're asking about decaf, but I'm going to tell you that really I would not recommend consuming more than 2 milligrams of coffee per day. So for those of you that are coffee drinkers, a cup or 2 a day should be fine. However, if you start experiencing things like heart palpitations, racing heartbeat, or if on ultrasound, the fetus is noted to have any kind of arrhythmias or in English, irregular heartbeats, the physician may ask you, are you a caffeine drinker? Because caffeine is known to cause or contribute to some of the things that I just mentioned. So that would be a reason, or those would be circumstances under which I probably would say, just, stay away from the caffeine, leave it alone, let it go. Sonia, I certainly hope that this has answered your question. Again, you can still consume coffee in pregnancy, but I wouldn't do more than 2 cups a day or go over that 200 milligram mark, which is the equivalent of more than 2 cups of coffee per day. So for you listening and submitting an OB question, taking the time out to ask, we will be reaching out to you to gather your information so that we can send you one of our bomb-ass t-shirts. Thank you so much. So appreciate your continued support. If there's anyone out there who is listening to the podcast that would like to have your question featured on the Ask Dr. Angela podcast, please go to www.askdrangela, that's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. In closing, I'd like to leave you with this. Accept what is, let go of what was, and have faith in what will be. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 22.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.